So, hoje nós estamos aqui com o Dr. Daniel Rey, meu primary doctor, e hoje a gente vai conversar sobre a importância de você escolher um bom doutor primário ou primary doctor para atender você e sua família. Dr. Daniel Rey, tudo bem?
Tudo bem.
Dr. Daniel Rey, he speaks English. In his office, he have his front desk. They speak português, eles falam português, eles têm a tradutor lá para te ajudar, porque é muito importante a sua comunicação com o seu doutor. Por isso ele tem uma boa assessoria em português para atender vocês. Então, Daniel, quanto tempo o senhor está primary doctor, nessa função de doutor da família? How long?
I've been a primary care doctor since 2004 when I completed my residency in family medicine. I chose that field primarily because of the fact that my doctor who delivered me actually I saw him as someone that had a broad spectrum view of medicine. He would do everything from surgery to primary care to taking care of any medical needs that the patient had. And I said, when the fact that I saw him doing that, I said I want to be just like him.
Yes.
And when I grew up, I started making necessary steps towards doing that, and I'm happy I'm here as a primary care physician today. So.
And I know that you take care of a lot of family, Brazilian people.
Yes.
So the first time I went to Dr. Daniel's office, I was surprised how he really cared about your patient. He take his time to explain in details everything about the exams when you go to labs. So, Dr. Daniel, eu fiquei surpresa quando eu fui com ele. Moro aqui há 22 anos, já passei por vários doutores primários. E uma das coisas que me chamou a atenção do Dr. Daniel Rey é o tempo que ele toma para te atender. É o tempo que ele toma para te explicar os seus exames. Isso é muito, muito importante quando você escolhe um doutor primário. Dr. Daniel, quais são os casos mais comuns que o senhor atende no seu consultório?
Well, the most common case that I come across in my office has to do with high blood pressure and diabetes. And unfortunately, a lot of our community has a lot of those things, a lot of those type of illnesses that they are not aware of until they come to the primary care doctor to be examined. And during that examination is when they're finding out that they have high blood pressure or diabetes or maybe some other medical problem that they weren't aware of. So this is where my job as a primary care physician comes in, where I have to do a thorough exam. And doing a thorough exam means checking everything, not just one thing here, or like some doctors do, they check one body system here, one body system there. We're trained to make sure that we check the entire patient. As a osteopathic physician, you check the entire patient and make sure that whatever underlying problem the patient has, including diabetes, including high blood pressure or other problems, that we can address them and help them to treat it.
Excellent, excellent. So another thing that I think is very important to have a primary doctor, the most important thing, eu acho que é muito importante você ter seu primário doutor, é porque se você tem um problema talvez de coração, o seu cardiologista aqui, mesmo você tendo seguro que não precisa ir no primary care ou no doutor primário primeiro, ele quer um histórico médico seu. Então ele quer que você tenha um referral do seu primary doctor. Então a importância de você ter um relationship com o seu primary doctor também serve para te indicar para o especialista quando você precisa. Por exemplo, um oftalmologista, por exemplo, o cardiologista, por exemplo, a outra que sempre pede, o ortopedista. Se você não tiver um primary doctor para te referir a esse especialista, eles não vão te atender. Mesmo que você tenha um plano PPO, eles querem um histórico médico. Então, essa é a importância de você ter um relationship, um bom relacionamento com o seu doutor primário. E aqui o Dr. Daniel entende a importância, he understands.
So the importance of having a primary care doctor is primary care doctor is like what they call in the United States a gatekeeper. And a gatekeeper physician means that you're the one in charge. And supposedly, the reason for that is because as a primary care doctor, as I mentioned prior, you're taking care of everything about that patient. You want to know everything about your patient, what's going on with your patient, what problems or needs they may have. And the reason for that is because sometimes the patient's care may require more advanced care. They may require to see a specialist. And the primary care doctor is the one that normally in the United States will refer the patient out to a specialist. So like you mentioned before, an ophthalmologist, they have some type of glaucoma or something that's severe that could potentially cause blindness. Yes, I would refer them out to a specialist, an ophthalmologist to be seen. Similarly, an orthopedic surgeon, if they have certain types of diseases that may require orthopedic care, then yes, I'm going to refer you to an orthopedic surgeon. And likewise to all the other specialties as well. So my job as a primary care doctor is very important in the sense that I have to evaluate the entire scope of the patient, what's going on with the patient, what's wrong, and if I can manage it on my own, then I will manage. If I cannot, or I feel the patient has a greater specialty care need, then I will refer the patient to a specialist for advanced care.
Exactly. Por isso que eu sempre recomendo um bom primary doctor. Aqui nos Estados Unidos, ao contrário do Brasil, a gente não vai pro hospital assim, para qualquer urgência. A gente sempre procura um doutor de família, um primary care ou um urgente care. Dr. Daniel, I was explaining to my clients why here is so different from Brazil, because in Brazil we go to hospital for everything. So here hospital is very expensive. So I explained that how it's important to have a primary care and do all the exams to prevent to have to get in a hospital. So the importance to have a primary care to do all the prevention exams. That's what you do.
Yes, my job is to, as a primary care physician, is to help to prevent disease. And how the system works here in the United States is that primary care doctors are primarily supposed to evaluate a patient's overall needs and to see if there's a need for the patient to require advanced care. So for urgent care needs or for primary care needs, the patient will come in to see me or any other primary care physician, and we will evaluate the patient, a full and complete evaluation. And if the patient needs to be seen in the emergency room, we will direct the patient there. Sometimes it can be that if they call and there's something that I realize that I may not be able to handle in the office, then I will direct the patient directly to the emergency room when those are emergent cases. For example, if someone calls and say I have, severe chest pain, having shortness of breath, I have pain, in certain areas, that I may suspect they may be having a heart attack or something, then I would not want that patient come to my office.
Exactly.
Obviously, I want that patient to go straight and direct to the emergency room or call 911 for help so they can, direct the patient there. So this is there are several ways in terms of dealing with the structure of how things are done here in the United States. It's a little bit different, but in overall, it helps the patient to avoid expensive costs of going to the hospital. An average stay in the hospital can run from a minimum of $5,000 to sometimes up to $100,000 a night. Depends on how severe your problem is. So if there is something that can be handled in the office or can be handled by the primary care doctor without directing the patient, without allowing the patient to have to endure those costs by going to the hospital, then it'll be better. The patient will be better served having to see their primary care doctor.
That's why it's so important. Por isso que é muito importante você fazer seu check-up anual com o seu primary doctor. Você pode prevenir ter que chegar aí a um hospital por uma urgência ou por uma emergência. Então, faça o seu check-up anual, chame seu médico da família, porque assim, prevenção é a solução. Esse é o meu tema. This is what I say for my clients. Always do your check-up annually, because that prevention is the solution. We need to have a primary doctor and do everything supposed to keep healthy. That's why you have a health insurance.
Absolutely, and that's a big part of it. Patients overall have to take their health care, very seriously. One, to be able to function and maintain adequate health for yourself and your families, but also overall to make sure that you don't end up in a situation where you have disease processes that advance to the stage where it can become a problem for you. It can become a very costly problem, and not only with your life but also financially as well. So it's very important to see your primary care physician to make sure that you can be, evaluated, a total evaluation, and also with the necessary treatment protocols that are in place to help you as much as possible. So having a primary care doctor in the United States is very, very, very important. I cannot, express how important that can be for our patient.
Just one more thing. Algum de vocês já teve algum tipo de sintomas, foram no Google perguntar o que poderia ser? Não faça isso. Chame o seu primary doctor, porque o Google é muito bom, mas ele pode te dar informações que vai te alarmar e às vezes uma situação que pode ser resolvida simplesmente com o seu primary doctor.
Absolutely.
Já aconteceu? It's happened to you? Some client comes like all scared because they read in the Google of symptoms of something.
Well, this is the thing. I always encourage my patients, because I have nothing in terms of to fear about what I tell my patients. I encourage my patients, if they want to Google, go ahead, Google, okay? And the reason why I do that is because I want them to be informed. My goal is to make sure that the patient know everything about their disease process as much as possible, so that when they come to my office, they have all the questions that they want to ask me. And no question is unimportant. Every question is important. So if there's something that you may Google, or something that someone else may tell you regarding your medical issue, and you feel like you want to ask me about it, I'm very happy to answer every and all questions that you have. That's my job as a primary care physician, to be able to help you in every possible way and answer your questions and direct you if there's a problem or something that needs to be addressed, for me to try to help you in every possible way to deal with that. I have no concerns at all about Google. I have no concerns about any of those things. Some doctors are fearful for it, but I'm not. I welcome it, actually.
Because you know what you're talking about. But yes. What I would say, some clients sometimes they don't want to go see a doctor. They go check Google. As I say, Google is good, but it's scary sometimes. I have this experience myself, so I recommend call your doctor.
Well, the reason why you have to be careful, just be careful with Google, is that you cannot just take that for your basic medical diagnosis, because sometimes the things that are on Google, Google doesn't evaluate the patient. Google doesn't examine the person. Google doesn't touch the person to see what's going on. So Google may give you a broad spectrum of things that potentially could be wrong, but it doesn't. As a doctor, you're there evaluating the patient. You have to know directly what's going on with the patient by just getting a history and everything like that, and doing a physical exam. And with all of those things, you can make a better decision and a more concise decision as far as what the patient diagnosis is. Unfortunately, Google doesn't give you all of those details. Wonderful things.
Exactly. That's why you have Dr. Daniel. Call him, make appointment. You have insurance, use it.
Yes, absolutely.
Good.
And like I said, I am happy to take care of every and all patients. My job is to prevent a disease and to help patients in every possible way to maintain health. And seeing me or any other primary care physician will be very beneficial for the patient's overall health. So that's very important.
That's good. Thank you, Dr. Daniel, for being here with us. VFB Insurance are here to help you to understand more how health insurance works in the United States. Nós estamos aqui para ajudar vocês a entenderem a importância de ter um médico e como funciona o plano de saúde para vocês. Se vocês têm um plano de saúde, use, chame seu médico, marque seu appointment. Não deixe passar 1 ano, 2 anos sem fazer o seu check-up anual. Pois é, doutor Daniel, mais uma vez, muito obrigado pelo seu tempo. Foi um prazer enorme ter o senhor aqui conosco, aprendendo mais sobre como cuidar da nossa saúde. Quem tiver interessado, quem gostou desse vídeo, se as informações foram importantes para você, compartilhe esse vídeo com outros amigos. Aqui está o contato do doutor Daniel. Entre em contato com ele também, faça os seus exames preventivos anuais e chama a VFB Insurance se tiver alguma dúvida, alguma pergunta. Estamos aqui para te ajudar.